so much, Dr. Neha. Shall we start the session? I'm Dr. Kirti, and I have been practicing integrative medicine for the last 11 years. And this is one of my expertise. So let us talk about a very common yet a difficult thing to manage, a disorder which involves excessive body fat. This is a general idea which we say that obesity means excessive body fat that increases the risk of health problems. The main concern will be around the health problems, the risk of health problems, and accordingly we will start our management things also. So, how we recognize obesity? It is a condition which arises from an imbalance in the body constitution, and this imbalance makes it a little harder to manage. So, some of the general factors that we all know, these are the most important cause, which is the major cause also, and everybody knows that it is the imbalance between the calorie intake and the energy expenditure. So, other factors contributing to excess fat accumulation are sedentary lifestyle, unhealthy eating habits, and emotional factors that will we will be discussing in detail. If the all of you are concerned with these things, also we'll discuss it in a little later. All right. So basically, what we target the laxity of fatty tissues and the body more than just weight in kgs. At this point of time, we are not concerned with the decrease in weight in kgs, as every individual is unique, and rather than concentrating on just kgs, that is quantity, one must, I think, concentrate on the tone of the body. So many a times loss in kgs is more loss in inches, sorry, is more apparent than loss in kgs. So in simple terms, when we talk about obesity, we have a general idea that too much of body fat. As we have talked about it earlier, obesity, it's a gradual process. It doesn't occur overnight. It is a gradual process, which is the discrepancy between the energy consumed and the expenditure. We know that. So some of the factors which are not easily visible, or some of the times we ignore these factors, these are also responsible for weight gain. So let us not directly go to the high calorie beverages, diet rich in calories that we all know. So some of these factors which are not clearly visible, but yes, they exist, are genetics. First of all, genetics that gives you a particular body shape. Family history. Family history, when I say family history, it means this members of same family have same eating habits, they have same activity habits. Children of the same family have a particular choice of a particular diet choice and physical activity. So it runs in the family. Sometimes unhealthy diet, of course, it is a major reason. We cannot avoid it all the time, but yes, it is a major reason. Other than that is sedentary lifestyle. It happens with as age advances. Sedentary lifestyle, it happens, we cannot put in effort as much as we used to put at the time when we were young. So emotional and psychological factors, this is a very big factor. We should understand that eating habits are influenced by emotions, such as at the time of you're sad, you have stress, boredom, sometimes anger, sometimes self consciousness, and secretly eating. It is a big factor. Uh, then the age. When we particularly talk about females at the time of perimenopause, that is 5 years around menopause and 5 years before and 5 years after the time of menopause, this is called perimenopausal condition. And in these conditions, basically, my female friends, any progress at this time will be slow, and that is okay, and you're not alone. This happens for two reasons you have to understand. Firstly, you're going through a bunch of symptoms right now, actually. And what happens? Disturbed night sleeps, joint pain, fatigue, bloating, mood swings, cravings. So many things are happening at the same time, and all of this makes it a little difficult for you to actually put in the effort that you need to. But you have to understand one thing, that you have to keep on putting those efforts even if you're not getting any result. But slow or no results can also benefit you a lot. Now, some of the general reasons that I have to explain, I have to start with, are gender. Men gain weight between the age of 29 to 35, and women usually and generally gains weight between the age of 45 to 49 years. That is actually the age I was talking about. Giving up smoking, yes, it also causes weight gain, but quitting is more important than possible weight gain. So we have to consider this thing also. Medicines, some of the medicines which we take for a longer period of time, they result in weight gain, like corticosteroids, oral contraceptive pills, antipsychotic drugs, antidepressants, so many things. So, what is the effect of these medicines? I will be explaining it later on. First, you have to just uh, assess your body according to the things I'm explaining. You have to just find out what are the underlying causes you have, because there are several things, there are hundreds of things, hundreds of factors I'll be explaining. But this is not the case. That will ultimately confuse you. So I'm going slowly so that you can assess your body, you can analyze your body accordingly. And this is the only way we can customize your therapy things. Okay. So some of the health conditions, they also have weight gain associated with them. This is because they slow down your metabolism. This is the main reason in hypothyroidism, in Cushing syndrome, in PCOS, and several other kidney diseases, liver disease, and heart diseases. So, and one more a, a very, you can see say a non-significant reason it looks like, but it is not. Water retention, we usually ignore this thing, but it is a major reason for your weight gain. What happens? What is water retention? It means accumulation of fluid in the body tissues. It causes pain, it causes inflammation, it causes sudden increase in the weight, and it responds very promptly with the diuretic therapies. So, do you feel sometimes that you feel sluggish, or you notice your hands, your feet, your face taking a little more swollen than usual? That uncomfortable bloated sensation may be water retention. Sometimes it may you may experience that means but often struggle to manage. It is likely water weight, the extra heaviness, and it makes you feel a little less about yourself. Let's understand what causes water retention. These are very smaller things. You can just change your lifestyle and you can see a drastic, a big difference into it. So first of all, high sodium intake, that is cravings for salty snacks, or spending most of the time eating outside. It causes a high sodium intake. It makes your body retain water a little more. Dehydration, yes, it might sound a little counterintuitive, but yes, not drinking enough water can make your body cling to fluids. It confuses your body, and your body system automatically starts retaining water. Hormonal changes, I have already talked about it. Hormonal changes during menopause, during pregnancy, at the time of menarche, or menopause. It happens because of hormonal shifts. Sedentary lifestyle, we all know that sitting or standing for a long time can cause fluid accumulation in your legs and feet. Underlying health conditions, that is the most important thing, and this is the only thing that you should always explain to your general practitioner, because this is the only thing is not visible from outside. So whenever you consult, go and talk to a general practitioner, you have to explain that you are on a certain medication, or for a long period of time you have been on a certain medical condition. What happens when you gain weight? You all know what happens: breathlessness, increased sweating, snoring, back and joint pains. You feel all the time, you feel tired, even with routine activities, and psychological problems also, that is low esteem, low confidence. All of these things are totally associated with weight gain. And also with my female friends, I would like to say that in at the age from 45 to 55, if you are feeling these kind of emotions, it is totally okay. You're not alone. You're completely fine. Just put in the effort you have to. You used to do it. Used to put in earlier. Okay. The one more thing that I'll be talking about is inflammation. Every time in your body, there are so many things going on, so many inflammations that you don't even notice, you don't even feel them, but they are there. They are inside your body. And this is the thing which is not letting your efforts work. So, chronic inflammation, when we talk about acute inflammations, these are clearly visible from outside. But what about chronic inflammations? Which they must be present in your body since maybe 5 years, maybe 10 years, maybe ages. It's possible. But chronic inflammation is linked to weight gain. What it does, it confuses your metabolism. It affects your hormones. It impairs insulin function. And when we talk about it imbalances your hormones or it affects your hormones, I'm talking about leptin, a specific hormone. Most of the people, you must not be knowing about that. Leptin hormone is a hormone which gives you a sense of satisfaction when you eat. When chronic inflammation occurs, it disrupts its functions, leading to increased appetite and fat storage. You don't know that you don't have to eat, but your body continuously signals you that you're not satisfied. You have to eat, you have to eat, and it leads to ultimately overeating and weight gain. So, how inflammation and weight gain has a connection? We have to understand because these days, anti inflammatory diets, these are given by all the dietitians along with the medical help that we can give you. So, let's understand how inflammation and weight gain has a connection. First of all, what it does, it disrupts your metabolism. This is the main major reason of gaining weight in your body. This is disrupted metabolism. Inflammation interferes with how body processes your insulin and ultimately leading to blood sugar levels increase, and as a result excess glucose gets stored or as a fat in your body tissues. It usually particularly happens around abdomen. Hormonal imbalances which is caused by inflammation. Leptin, as I've already talked about, it is a hormone which gives you a feeling of satiety. The inflammation disrupts leptin and it causes increased hunger and ultimately overeating, which is going to affect your weight gain. Cortisol, it is a stress hormone. Chronic inflammation, it raises cortisol. As a result, stress increases, you overeat, and weight increases. So these are the major reasons. I'm not going into deep things, but these are the two hormones I think everybody knows about it, the stress hormones and the hormone which gives you a sense of satiety. So it is necessary to explain just these two things. Otherwise, inflammation and weight gain, it is a vicious cycle. Whenever you have a weight gain, inflammation will increase in the body, and with the inflammation, again the weight gain. So it causes a vicious cycle. Now, as we have discussed, the two major things which are a little away from the general knowledge are water retention. So let's see management of water retention, what you can do at your home. We will be helping you with the medical advices, but the things that you can do at home are how to lose water weight naturally. So what you can do is increase potassium intake. What does it do? It helps balance sodium levels and flush out excess fluids. So some of the food that I will be suggesting you for increased potassium, that are bananas, the avocados, you can have sweet potatoes, you can have spinach, you can increase the quantity of these things in your diet. Other than that, stay hydrated. Please don't confuse your body. You need water from outside. We don't need our body to get confused and retain the water that has to be excreted out. Sip herbal teas. Herbal teas have a unique feature of uh, they are you can say they are natural diuretics, and this is the way they help you reduce the retention of water in your body. Some of the herbal teas that I will be suggesting are ginger, dandelion, and green teas. Cut back on refined carbs. Refined carbs means sugary and processed foods. As we know, it causes insulin spikes, leading to, again, more water retention. It will, again, disturb your metabolism, and the same cycle goes on again and again and again. Move your body. I know with age it is a little difficult, but whatever you can do, just 30 minutes of moderate workout, exercises, doing nothing is not an option, basically, but just move your body uh, to the limits your body allows. All right, reducing salt intake, which also makes your body to retain fluid. So please reduce salt intake. Massage therapies. A good lymphatic massage can help you drain out excessive fluids. Dry brushing, which increases circulation. Epsom salt baths, they draw out toxins and excess water from body. These are some of the things that you can do at your home to get rid of water retention. First of all, because if we plan any diet plan for you or any medical prescription for you, the first and second week, that is almost for 2 weeks, you'll be feeling that if you practice these things at home, uh, get you'll get a very good result, actually, because first 2 weeks take the water to flush out of your body. Now, some of the general measures that we can do for obesity management, they focus on lifestyle changes. They focus on balanced diet, regular exercise. Regular exercise means you have to be just regular. You don't have to stretch your limits. You have to be regular, and sufficient sleep. Sufficient sleeps cause less secretion of cortisol, stress hormones. As a result, you don't eat much. As a result, it gives you relief from your weight weight increase. All right. Some dietary changes that we can do our balanced diets. See, taking 3 meals a day, that means the breakfast, the lunch, and the dinner, is not the complete requirement of our body. There is some gap which has to be filled, and these are completed by the diet, which is rich in fruits, which is rich in vegetables, whole grain, and lean protein. While limiting, and you have to limit the processed food, the sugary drinks, and unhealthy fats. Portion control. When we talk about portion control in integrative medicine, we have a way how to find out that this portion is the right portion for me. I am 40 years old. Some other female must also be 40 years old. But this is not necessary that the portion I consume is the right portion for that lady also. So, what we have to do, I will tell you, and you have to start trying and practicing this thing. Our stomach has three parts. One third of the stomach should be filled with solid portion. Next one third should be left for liquid. And the remaining one third should be left empty. This is the way to consume the right portion of food. uh, Hydration, again, to provide satiety and overall health. Sometimes we think that we are hungry. After every 1 hour, after every 2 hour, you feel like you're hungry, you have to eat something, you have to eat. Just try this thing, just have a glass of water, and you will see that it will give you the same quantity of satisfaction that you get from a plate, a bowl of these unhealthy things. Fiber intake. Of course, fiber-rich food, it gives you a sense of fullness. It aids in digestion. It creates bulk, and it stretches the time from one meal to another. You don't need to consume smaller amounts all the time after every half an hour, every 1 hour. You don't need that. Regular physical activity. When I talk about regular physical activity, I'm talking about that you have to analyze, you have to assess how much you have to work out. This is not necessary that the time given 30 minutes of my moderate workout is sufficient for you to, or the other women, you can start slowly and gradually increase the intensity of workouts. You can do a variety of activities, like you can walk, you can run, swim, cycle, or dance, anything. Basically, physical exercises, yes, it directly is involved with the um, fat reduction in our body, but it also causes release of less stress hormones as a result. Of course, I've already explained what is the result of less stress hormones, less cortisols. So start gradually and gradually increase the intensity of workout till your body allows. Stress management is very important. Practice mindfulness, meditation. You can do deep breathing or yoga to reduce your stress levels. Adequate sleep, that is at least 7 to 8 hours of quality sleep. When we talk about sleep, this is not just that you have gone to bed and you have spent your 8 hours on bed. No, it should be a quality sleep, calm, comfortable. Hobbies and social connections are very important. These are all directly or indirectly connected to your stress hormones. You should engage in activities you enjoy and maintain strong social connections to support your well-being. Natural supplements and herbs. Now we come to some medical advice that I would like to give you a little more. Like green tea, you can have some green tea, turmeric, ginger, some of the spices, which what do they do? They control your appetite and burn fat. Important consideration that should be that should you should keep in mind are, first of all, consult with a healthcare professional. Whenever, please don't never try to self medicate yourself with these things. Please take a healthcare professional's guide consultation. Focus on sustainability. You start with a all of these, you aim for a gradual and sustainable changes rather than quick fixes. Weight reduction is not a quick fix. It will take time. Be patient, be persistent. Weight loss takes time, it takes efforts. So please be patient. And one more thing, please be gentle with your body. Don't try to do it in a month or a 2 or a 3. No, it will take time. And please be patient and persistent with your healthy habits. Address underlying causes. You always have to address your underlying causes, your diseases, your medication to your health professional. Then only you'll be able to get your customized uh, prescriptions. Other than that, some recommendations which are natural, some of our natural remedies, you can say them, this use of millets, you can have water infused with a good quality honey, use of buttermilk, of warm water, spices, of course, they enhance your metabolism, and green gram and horse gram. There are some certain medicines also which I'll not be explaining here and I'll not be mentioning here, because this is completely a different thing and you have to consult your doctor, you have to consult your practitioner before that. And this is customized for every person separately. So these are just the things that I had to discuss. And also, again, for my those female friends which are in the age of 45 to 55, the estrogen levels drop at this time, so you end up losing muscle mass, and so your BMR reduces. As a result, you're not burning as much calories as you used to burn on a daily basis you did before. So even though your progress is slow, the effort that you need to put in is exactly the same as before. Eat mindfully, move regularly, and sleep well. Thank you so much.
Thank you, Dr. Kirti.